Hello, my name is Dr. Martin Edlinger. I'm an Austrian general practitioner working in Spain, and I found a company, Vitamic company, with a nutritional supplement with high bioavailability, and we did a COVID study.
Hello and welcome to Long COVID Foundation podcast. At the Long COVID Foundation, our vision is to improve health and well-being of long COVID sufferers by contributing to long COVID diseases understanding and treatment options. And to do this, we work with organizations and individuals of medical profession, scientists and researchers, and long COVID interest groups to promote awareness of long-standing symptoms, health and rehabilitation challenges. This is the channel where you can find information relevant to your symptoms. So if you're new to the channel, please make sure you hit subscribe button because I can help you get answers relevant to your symptoms. Thank you, and let's jump into today's presentation discussing very promising solution for long COVID called Vitamic Biosen. Those who follow us most probably have heard that with the number of long COVID sufferers reaching over 180 million worldwide, we're very desperate to find safe and promising solutions to tackle long-lasting symptoms and help people recover sooner. So if you have solutions in mind, which would please get in touch. We want to hear from you. And today it's my pleasure to welcome our guest, Dr. Martin Edlinger, who is a specialist in general medicine. Dr. Edlinger is Austrian doctor practicing in Altea, Spain since 2002 and is head of the Clinica Austria. He has been working on the topics of long COVID and post-vaccine syndrome for quite some time. The product which will be presented today, Vitamic Biosen, is a revolutionary liquid nutritional supplement with bioavailability of 95% thanks to micellization of its main ingredients, turmeric, boswellia, and vitamin C. So Dr. Edlinger, welcome to our channel.
Thank you, Valentina, for inviting me today to present the new supplement, Vitamic Biosen, and the good results we had when using it in a long COVID study.
Thank you very much. It's my pleasure to give you an opportunity to share your findings. And if you could please share your slides. Thank you very much. So the floor is yours.
Good. When we talk about this new supplement, this Vitamic Biosen, we have to talk about the technology behind, the technology to improve the bioavailability of this product, because it's important, whatever you take, to absorb it in the intestines. So Vitamic Biosen is a product with a high bioavailability of 95%. That's why we have strong effect in a short time and effect without side effects. And this is the title of today. Let's start with the first slide. We're talking about micelles. What is a micelle? A micelle consists of an active substance inside and amphiphilic molecules outside. So you will ask yourself, what's amphiphilic? Amphiphilic describes the chemical property of a substance that's hydrophilic and lipophilic. On the right side, we see, for example, an orange spot in the middle. This might be now a curcumin, and white spots around. This is the hydrophilic layer. And these amphiphilic parts bind it to each other in the dispersion medium water. In micellation, the amphiphilic substance is gummi arabicum, is gum arabic. In nature, also we produce daily in our body micelles with the bile acids. So whenever we eat something containing fat or lipophilic substances, we have to micellize this, and this is done by the bile acids. Today we're talking about Vitamic Biosen. This is a product contains of 3 major natural substances: curcumin, frankincense, and vitamin C. The curcumin and frankincense have been traditionally used in the Ayurvedic medicine for thousands of years to treat inflammatory diseases. Vitamin C, there's nothing to tell about that, everybody knows. And there are many studies around curcuma and frankincense, more or less 46,000 on the curcumin only. And this makes the curcumin the best studied herbal substance in the world. The anti-inflammatory effect of curcumin and frankincense is well known, and also the European Commission classifies both active substances as safe and effective. I've been using this substance now since February 2021. I got the chance to get to know this substance because of a patient. He was telling me that this is produced in Switzerland. I went there came back with some bottles. We're talking about drops today, and I've been using it for people with chronic inflammations, with autoimmune inflammatory diseases like rheumatoid arthritis, psoriasis arthritis, degenerative rheumatic diseases such as osteoarthritis, and other rheumatic diseases, inflammation of tendons and muscles. Had some patients with ulcerative colitis, colitis ulcerosa, and Crohn's disease. You can use this product also for treating viral infections. We will talk about later about long COVID. Viral infections of the respiratory tract, the herpes simplex or herpes zoster. What's really interesting is about the herpes zoster. I normally see in 1 year about 3 patients with herpes zoster, and last year I had around 30 patients. And these 30 patients received the same medication like always, the antiviral medication, the pain treatment, but I added the Vitamic Biosen, and I noticed I've been more or less 50% of the patients afterwards, and none of them had problems with the post-herpes pain. And this was amazing. The guy in the picture, this is a video, is Antonio. He's a triathlete from Lisboa, and he will share his experience with you now in a short video.
I start taking Vitamic Biosen drops 3 times a day, and she told me it's a miracle. My name is Antonio Cruz. I'm from Portugal. I do triathlon and run marathons. I used to have Achilles tendon problems since 2 years ago. Every week I go to the physio, and when I start taking the drops from Vitamic Biosen, the next week I went to the physio, and she told me, what is going on? Your Achilles tendon is great, is equal to the other one. What you are doing? And I told her I start taking Vitamic Biosen drops 3 times a day, and she told me it's a miracle that you already fixed it, and now I don't need to go to physio. And now I feel that I recover faster every time I go for practice, or every time I go for riding my bike or swimming. I went for the marathon, recover in 2 days. It was great. And I start taking Vitamic Biosen every day, and I share with my friends. They already started doing that, and it's feeling great.
We did the long COVID study from June to end of August this year in Madrid, Barcelona, and Valencia. We took 60 people suffering from long COVID after the first vaccination. They had the first symptoms with Vitamic Biosen twice a day, 10 drops. Of course, you can use the Vitamic Biosen as well to strengthen the immune system. All my patients for the moment take this substance. What's very important to know is whenever you give the Vitamic Biosen to your patient, please don't change the medication they have at that time. Try at first. If symptoms get less and the patient is satisfied, then discuss with the patient or tell them they should discuss with the doctor, maybe to decrease the normal medication. The data from our long COVID patients I've been treating since March 2021. This was the number in beginning of September, 224. Now we have around 300, but the symptoms are more or less the same. We have 27% male and 73 female. All of them more or less had the chronic fatigue in the beginning. Then many of them had loss of smell and pain in their legs, pain in the arms, loss of taste, brain fog. I had less in my clinic. Normally, internationally, we see more. Headache. That's more or less all the symptoms. How did we treat them? We treated them always with 10 drops twice daily. I advised all my patients, this was good because I had them here in my clinic. I advised all my patients to take the drops orally. That means in the mouth, directly, sublingual. And most of my patients, they're again amazing. They were symptom-free in 2 weeks. I will talk about that later, why it was possible. And the recommendation was to continue the treatment as a maintenance dosage twice a day, 5 drops. So the studies we did is one now, the long COVID study is completed or was completed end of August. Next year, we want to do another study with berberine. This will be a study with diabetes type 2 patients and also another study with fibromyalgia. We used then a Biosen and together with a vitamin B complex. Now I want to introduce the doctor who led the study, Dr. Marik. He is director of the long COVID Department of Precision Medicine and Post-Viral Syndromes in the Blue Healthcare Clinic in Madrid. He will present himself, what he's doing.
Soy el doctor Francisco Mera, soy médico de familia, tengo un máster en diabetes y nutrición y dirijo la unidad de síndromes postvirales de la clínica Blue Healthcare en Madrid, España. Vitamic Biosen es un producto que tiene la capacidad antiinflamatoria y de modular la respuesta inmunitaria. Lo extraordinario de este producto es su alta biodisponibilidad que producirá una acción antiinflamatoria frente al dolor y otros procesos inflamatorios, así como una acción inmunitaria de alta potencia. Tenemos una acumulada experiencia en el control del dolor y de la inflamación de diferentes pacientes, así como síntomas como de la fatiga. Grupos poblacionales como puede ser el COVID persistente, dolores osteomusculares, así como en grupos poblacionales como son los deportistas de élite profesionales. La COVID persistente es un síndrome que aparece en pacientes que han sufrido la infección por la COVID-19, que refieren a astenia, fatiga, dificultad respiratoria o niebla mental. El uso de Vitamic Biosen hemos comprobado a través de estudios clínicos y también con nuestra experiencia clínica en el día a día, una mejora de todos estos síntomas como hemos comentado. También en pacientes con dolor osteoarticular, dolor inflamatorio, por ejemplo asociado a la artrosis, hemos observado una clara mejoría y reducción del dolor en estos pacientes con el uso de Vitamic Biosen. Por último, tenemos una grata experiencia en pacientes de élite profesional que lo usan para la práctica clínica, para su práctica deportiva, ya bien sea en el mundo del ciclismo, del atletismo o el motociclismo, entre otras disciplinas deportivas. Hemos observado en este tipo de pacientes que Vitamic Biosen es un producto que produce mejora en cuanto a la recuperación, así como la reducción del dolor producido por las lesiones típicas del deporte que practica.
I know Dr. Marik now more than 1 year. I think I got to know him in August last year, and he convinced me in January to make this study. The long COVID study we did in June to August had to show the effects of Vitamic Biosen at clinical evaluation with fully vaccinated symptomatic long COVID patients. So we wanted to show that the clinic gets much better within 6 weeks. And the other thing was to identify the response with biomarkers when you give Vitamic Biosen over a period of 6 weeks. That means we checked the blood. We took blood first in the beginning and second after 6 weeks and realized the change of the biomarkers. When we're talking about long COVID, we're talking about long-term effects of COVID-19. It's estimated up to 30% get symptoms after SARS-CoV-2 infection. The 5 most common symptoms are fatigue, 58%, headache, attention disorders, which is brain fog, hair loss. I've seen very rare, here a high number, don't know why, and dyspnea. Due to the economical impact that long COVID has on the economies, we see that multidisciplinary teams are crucial to develop preventive measures. Also, the rehabilitation centers in Austria, they are full of patients, and all the hospitals try to find out better strategies to fight against long COVID. How does long COVID occur? It's always microclot-based event that leads to oxidative stress, and that leads to more inflammation And as we know now, what's the origin of long COVID? These processes suggest the therapeutic benefit of antioxidants, anti-inflammatories, and anti-clotting agents. Again, how does long COVID occur? There are direct and indirect influences. As a consequence of the viral replication, leads to defensive struggle of the immune system. The result is inflammation, and the inflammation provokes microthrombi, microclots in the smallest vessels. Again, oxidative stress, more inflammation, and the effects are possible in all organs. And that's why now we use antioxidants, anti-inflammatories, and anticoagulation as a therapy of choice. And when we have a look now at the Vitamic Biosen, the curcuma, for example, is thought to be antioxidant, anti-inflammatory, and even anticoagulant. The hypothesis of the study was, may Vitamic Biosen stop the long COVID pathophysiological disorders? And second was to show if biomarkers from the NHPAC panel, this is a panel especially designed for long COVID, helps us to identify and monitor beneficial effects of Vitamic Biosen given 10 drops twice a day for 6 weeks. The purpose of the study was as a main objective to evaluate if Vitamic Biosen alleviates the clinical symptomatology of patients on the 6th week of follow-up. That means if we see clinical improvement of the patients when they take the Vitamic Biosen for 6 weeks. And the second was to see if there is any relation between the clinical symptoms and biomarkers tested from the encephalopatopulmonary axis. On the next slide, we see some markers. Let's find the marker in between. This is the A2M marker, the alpha-2 macroglobulin marker. On the left side, we see blue dots. On the right side, the green ones. The blue ones are high, increased in the beginning, and at the end, we see a decrease of the marker. This is a marker, for example, that stands for liver diseases. Right side, we see the CRP high, and at the end low, another well-known biomarker. For me, it's an inflammatory marker, a normal one. And Phet-A, next one, interesting, also responsible for liver disease like the non-alcoholic fatty liver disease. And as a consequence for diabetes, high in the beginning, low at the end. The next one is HEP, left side down there is a marker, stands also for breast cancer, high in the beginning, low at the end, but here is an inflammatory marker. And the SAP, the last one, we see a dramatic change, is a marker, it's called serum amyloid protein, that was high in the beginning, low at the end. SAP is a marker with a correlation to microclots and even amyloid protein deposits in the central nervous system. Another type of graph, but we can see that Vitamic Biosen again remarkably affected the blood level of the immunoinflammatory biomarkers, especially those from the A2M, the CRP, the Phet-A, and the HEP in the majority of the treated long COVID patients. The conclusion at the end, we can say the study has helped to biologically phenotype the patients with long COVID-like symptoms after vaccine immunization. And the study has shown beneficial effects in terms of clinical and biomarker reduction in long COVID patients giving Vitamic Biosen. We have seen a significant improvement of dyspnea, sleeping disorders, headache, and depression after taking Vitamic Biosen. And we have seen also an improvement of pain, mobility problems, and concentration problems. What was achieved? The positive effect of the Vitamic Biosen on long COVID symptoms was confirmed in the study. And Vitamic Biosen is indeed now currently the only food supplement that can be used to this extent and without known side effects in long COVID. And Vitamic Biosen, for the moment, I think it's the only substance. There was even no medication tested with this biomarker panel that shows clear effects on biomarkers in laboratory results. And now, interesting, what do I do when people come into my clinic? I see them, I can ask them for the laboratory results, the last ones they had, if they even have. The patient needs additional information. And I can give them when I, for example, control something essential. This is the vitamin B12 level and the vitamin D25 level. Both must be in the upper normal range, which is 9 of 10 patients I've seen, it was not the case. The vitamin D25 should be over 80 or minimum 80, and the vitamin B12 should be over 600. When we, for example, compare the normal range of Austria, Spain, or Japan, we see in Austria it's enough when you have more than 190, in Spain 280, and in Japan it's 500. And I can tell the patients also, and I would recommend to do so, they have a better effect when they take it sublingual. That means directly in the mouth. Now let's hear what Dr. Mero Cordero tells about the study and his experience.
El estudio Vitamic Biosen es el primer estudio científico que está realizado fenotipando biológicamente a pacientes con síntomas de COVID persistente después de la vacunación contra el SARS-CoV. El estudio de Vitamic Biosen es el primer estudio que ha utilizado estos biomarcadores para valorar el daño de la enfermedad, así como la respuesta a un tratamiento natural. Se ha utilizado el compuesto de Vitamic Biosen, suplemento alimenticio, y se ha comprobado cómo había una mejora en los síntomas y en los marcadores biológicos de la enfermedad de los pacientes de long COVID postvacunales. Las conclusiones han sido que mejoraban la inflamación de los pacientes de long COVID postvacunal en sus marcadores hepáticos entéricos y también en el depósito de amiloide, de proteína amiloide en el cuerpo. Ello conllevaba también una mejora clínica en síntomas como la disnea, el dolor, trastornos de la motilidad digestiva, trastornos del sueño, problemas de concentración, así como problemas de índole neuropsiquiátrica, entre otros.
Thank you, Dr. Mero Cordero. We're talking about a new supplement, a supplement that never existed before. I was never thinking to use supplements in my daily practice because normally I couldn't see effect within 1 week or 2 weeks. And my patients, they want to leave the clinic best healthy after treatment. Not always possible, but now with this new kind of supplements with a high bioavailability up to 95%, we can have these results. And so I would really like to invite you to try out the Vitamic Biosen with your patients when they have long COVID, because there isn't any risk. I didn't see until now any side effects. And when you want to order, do it on vitamic.com. And if you have any question, please write to info@vitamic.com. I will answer in a short time. Thank you.
Thank you very much, Dr. Edlinger, for this informative presentation. And I think it's worth saying that it's great that we are now seeing more and more natural compounds are being used in the treatments of long COVID, because patients are waiting for quite a long time to be seen by specialists. And it's great to know that there are solutions that they can take and try them, because these solutions are safe, underwent trials, and there is data to support these claims. So thank you very much for doing this for long COVID community. Now we're gonna have some questions to make our listeners a bit more aware about the compounds you used and why bioavailability is, for example, important. So could you share some information on symptoms that are best tackled with this solution? So we know that people suffer with fatigue, with brain fog. So for these particular solutions, which symptoms in your experience are tackled the best?
Okay, I can tell you in my clinic, I told you before, I had more or less 300 patients now. And of course, you're learning. And now I think when I have a patient with chronic fatigue or brain fog, even pain, neuropathic pain, I always do the same. I just check the markers. I check the vitamin D level. I check the vitamin B12 level. And I try to substitute when it's low to the upper normal range. And then I give them the drops. And normally they tell me after 1 week, normally people, when they are tired, when they have this chronic fatigue, they tell me in 1 week is much better. And also the brain fog normally disappears in between 2-3 weeks when the vitamin B12 is high. Of course, I have also patients, there is no reaction, normal, but I've seen, and I think I have the same experience now like Dr. Boguero. He is also recommending this product in his clinic now to many patients. And he told me 3 or 4 patients get much better in between 2 to 4 weeks. And there is no risk. You can take it. You have no side effects. And the product is not very expensive. You pay 7 to 9 euros for 1 bottle. And for treatment, you need 10 drops twice a day. And when it's better after 2 or 3 weeks, I always recommend to reduce to 5 drops in the morning, 5 drops in the evening, and then it lasts 2 months.
I see. So can we get back a little bit into the trial you organized? So was only Vitamic Biosen used during the trial, or people had their own medication that they used to take as well as Vitamic?
No, the people didn't have their own medication. They were tested in the beginning with the biomarkers, then got the Vitamic Biosen, and after 6 weeks, they were tested again.
Because people are taking their own medication at the moment. They take blood pressure medication, they take anti-inflammatory medication, they take painkillers, for example. And when you add Vitamic Biosen on top of it, is it worth combining all together, or it's best to stop everything and try only Vitamic?
No, I would of course, I would go on with the vitamin D, of course, the vitamin B12, pain medication. As far as they don't really need, I would stop, because then you see the effects, I think, because when you combine ibuprofen, for example, with the Vitamic, I don't think this makes much sense. But what's really a good, biggest problem sometimes is to convince the people that it makes sense to control the levels of the vitamin D and the vitamin B12, because most of my patients, they take vitamin D and they take vitamin B12. But then they are surprised that the levels are still low. So it's really good. I can recommend everybody to test his levels to find out if it's really sufficient what he's taking. And the supplements, of course, we have always the same problem with the bioavailability. And some people, they absorb, and some people, they don't absorb. And in case of the vitamin B12, for example, you can support them with an injection, for example, with cobalamin, the methylcobalamin or the hydroxycobalamin. Very easy, and they get levels around 800, 1000 within some days. It's not a problem. And the vitamin D as well. The dosages we see for the moment, 1,000, 2,000 units a day, and then they even don't reach the 35 or 40. It's not enough. So we're talking about 6,000, 8,000 sometimes, and then they go up to 70 or 80.
When you mentioned bioavailability, could you please explain what it is and why it is important to have high bioavailability of natural solutions? The
bioavailability is nothing else than the absorption in the intestines. So when you take, for example, there are a lot of products in the market of curcumin. Many people, they take curcumin and they tell me they take the capsules. They are taking the capsules. And then I tell them, maybe the capsule you take, you have an absorption of 2 or 5% only. And when you take more, then maybe you have then side effects. You have stomach problems. And when you take the drops with a high bioavailability, then you have an absorption rate of 95%. And that's why we have these effects. I think you will never reach this effect with capsules or tablets.
And in this technology that you mentioned at the beginning is MyCell technology. I would assume this particular technology makes the bioavailability such high in this particular solution, because it delivers it to the place where it needs to be absorbed, isn't it?
Yes, this is the MyCell technology that does nothing else than just copy the natural process that's in your body, always done, but only at a very high amount. So the body itself can never mycelize that much that you can do outside of the body in the laboratory, and then when given to the patient.
So how does, I think you partially mentioned this, so how does this particular solution compares against the scenario when people are taking separately vitamin C, boswellia, and curcumin as capsules, as supplements? Will they reach the same effect?
No, this is impossible, because they, whatever they do, if they combine it or take it as one substance, they will never have this bioavailability, because it's not possible, because we're talking about lipophilic substances. And as I told you before, these substances, they cannot be absorbed in that amount in the intestines. So they have to be micellized. The body itself will do it, but only to a certain amount. And I think the limit is really 5%. And then we have another substance that is 20 to 50 times more potent than the capsules.
Thank you, thank you. So we have quite many severe cases of long COVID patients who suffer over 2 years now. And what would be the recommended dose and duration for first improvements to be seen for this group of people who suffer for quite long?
Severe symptoms, I think severe symptom is also when somebody has a brain fog. I remember one case, the daughter of my cousin, she had long COVID and she had this brain fog, but very severe. She told me on the phone, she's 28 years old, young girl, more or less, and she was cooking, and some moment she was asking herself what she's doing. So this is really severe. And I recommended the same. She had, this was interesting, she had also a very low dose, a very low level of vitamin B12. And the doctor told her, excuse me, that I never controlled it. And also the vitamin D was very low. I told her to make the substitution with an injection vitamin B and to take drops for vitamin D. And I recommended to her 10 drops in the morning, the same in the evening. And 2 weeks later, she called me, more or less okay, everything. And
so within 2 weeks of taking twice a day, people should see first improvements.
Of course. So if you don't see any improvement in 2 weeks, there will never be improvement, but this is very rare. I had most problems I had with loss of smell, and until now I don't know why. But
Right.
symptoms like brain fog, chronic fatigue, muscle problems, neuropathic pain was never that problem. No.
Very interesting. Any side effects that people should be aware of or you have observed in your patients?
I observed one side effect. I think that lady was allergic against boswellia. That means against frankincense. This might be possible, but I haven't seen any severe side effect, nothing. But I would never recommend to take it together with syndrome, for example, the anticoagulants. The new ones, some say, if you read in the literature, they don't recommend, and others say it's not a problem. But I always tell them to be careful whenever they take anticoagulants, but really when they take syndrome, because then they would have to control it more often. So if they do it, they can take it as well, of course.
Okay, so when people are on anticoagulants, it's better to reduce the dose, stop them completely, and then add Vitamic Biosen to try.
So if they have coagulants because of heart problems or of thrombosis, of course they shouldn't stop. Wouldn't be good. But just be careful. I think one case I would never recommend is the syndrome, because you never know if the people really control it afterwards. When they go 4 weeks later and you have an INR of 6, then you have a problem. But only for syndrome, that's all. And I always don't recommend, of course, for women pregnant, for example, and also breastfeeding, because the child could be crying the whole night because it would be too active.
All right.
This is also one point interesting. Now, when I tell you too active, all those patients that take it tell me afterwards they are more active, and there were many that told me really they are better than before. So this is interesting, because as far as I know, there is not even one substance existing that makes you more active. And I've seen in many cases, then at part of long COVID, old people, I have many old people here, and they have this problem. And for example, they ask me, don't you have anything for my husband? He's always so tired. And then 2 weeks later, he is active. Wonderful.
Great results. So what is the price, how to order it, and do you post worldwide at the moment?
For the moment, we post in Europe, but I think it's also possible whenever we asked, maybe from a long COVID association, we can send them more bottles, for example, then it's cheaper. If they order 1 bottle, they have to pay the delivery. If they order 2 bottles in Europe, then it's free to all countries, including England, of course, or Switzerland. And we have sent also to Saudi Arabia and US. That's possible. And the price for 1 bottle is 79 euros, but included.
Okay. Thank you very much, Martin, for your time. I hope you find this information useful, and please share it among those who may benefit from this solution. And please help us raise awareness about long COVID and its impact on people's well-being. Thank you for watching, and goodbye.
Thank you, Valentina. Thank you.